Do you know what endometriosis is?
Kind of.
No idea.
No.
Yeah, I think I do.
Yes.
Yes.
No.
No.
Yes.
Hi, how are you? So we're just going to talk about endometriosis for our documentary.
Great, sounds good.
How common is endometriosis in Australia? Who does it affect age-wise?
Sure, so endometriosis affects 1 in 10 women and girls in their menstruating years. It can affect women and girls from a really young age, usually from 11 years old when they first start their cycle, and it can be really distressing. They often get painful periods and they're not quite sure what's going on with them because we've normalised pain and we've normalised painful periods as normal, which they're not.
Symptoms include fatigue, pain that stops you during or around your period, pain during or around ovulation, pain during or after sex, pain with bowel movements, pain when you urinate, pain in your pelvic region, lower back or legs, having trouble holding on when you have a full bladder or having to go frequently, and heavy bleeding or irregular bleeding. It takes an average of 7 to 10 years to diagnose endometriosis, the disease experts call the silent epidemic, and because of the lack of public awareness, women are falling through the cracks. Because young women think it's normal to have pain, they usually don't seek medical advice but prefer to self-manage with heat and over-the-counter painkillers. Without medical help, women can suffer from severe pain for several years.
Endometriosis is diagnosed through laparoscopic surgery. It is the gold standard for endometriosis care, and what's something that's really important for girls to ask is their specialist, an endo specialist, going to excise the endometriosis, which means cutting it out, or ablate the endometriosis. And that includes hormonal treatments, surgical treatments, allied health and natural therapies. So to be diagnosed, currently the gold standard is to have a laparoscope surgery. From there they can have hormonal treatment such as an IUD, go on the pill. There's lots of different options, but girls need to talk to their specialist about what's right for them.
We interviewed Rachel Hart, a young woman on her endo journey, to find out more about how her diagnosis has changed her life.
What was your experience with the surgery like?
My healing process. Most people take 2 to 3 weeks to even be able to get out of bed. I am such an impatient and stubborn person that I got out of bed after 4 days. So it was Boxing Day of 2017 and I was meant to be on the floor with customers, and I had not 1, not 2, but 3 cyst rupture, and that's a very rare thing in the first place, but I had them rupture 1, 2, 3, and I should have let them call an ambulance, but I didn't know any better, so I pushed myself to work through it, and I mixed a lot of different pain medications.
As endometriosis can affect women in multiple ways, treatments are extremely personal to each individual. In some cases, infertility can occur. In fact, around 30% of women with endometriosis have trouble getting pregnant.
This is due to scarring of the tubes and ovaries, problems with the quality of the egg, problems with the embryo travelling down the tube and implanting in the wall of the uterus, and change of the organs in the pelvis, such as adhesions with scarred pelvic tissue and blockage of the fallopian tubes. Some women with endometriosis feel pressured to have children as soon as possible to increase their chances of becoming pregnant.
It's a significant issue throughout the world, with approximately 176 million women and girls living with endometriosis. So what more can be done to help them?
I believe education is power, and having that knowledge and educating and encouraging young girls to be their own advocate. And we have support lines, we have programs and workshops, and when girls come under our wing, and we can really help them by guiding them.